use of agency personnel. It's a Band-Aid solution.
As we're told, long emergency wait times are in part due to staffing concerns. The United Nurses of Alberta raising their concerns about how some unfilled shifts get staffed. So-called travel nurses now needed in major urban hospitals.
Outside of Edmonton, the half of the staff working the shift were agency nurses. It's just, and I can't say, it was unheard of in my experience.
Travel or agency nurses are contracted out through private companies and generally paid more. The non-union workers often address hard-to-fill rural positions, but the union has heard of more and more in and around Edmonton and Calgary.
It's our public dollars that are ultimately paying this because we don't have the ability to retain and recruit ourselves.
A claim Alberta Health Services says is misleading, noting no significant increase in agency staff in the two major cities, although 50 in Edmonton at the start of this week, and not clarifying if this includes hospitals in the metro region, but confirming there has been an increase in need in rural and remote areas. Alberta went from 220 agency staff in May to over 340 now.
For the short term, yeah, this is a good solution. Gets the nurses wanting to work, gets immediate gratification with the money, and the nurses will get their vacation because they won't schedule themselves.
The president of one of the agencies says since graduating in the 80s, she's witnessed the staffing issues, creating nurse relief to fill some of the gaps. She finds young nurses gravitate towards travel nursing, where you're paid more up front, but also have no access to pension, sick time, or disability benefits for the flexibility.
And this has been a crisis since I graduated. I don't know why it's not looked at a little bit more seriously, because right now and during COVID, it was really scary.
Both the union and the president of Nurse Relief agree long-term solutions addressing working condition, as well as recruiting more locally and abroad, is needed. AHS telling City News they are aggressively recruiting, and there are 1,800 more RNs now compared to 2019. In Edmonton, Carly Robinson, City News.